you do snore. Quite a bit.
Colby's got one last chance to solve his snoring problem for good.
It was a pretty easy decision to say, all right, let's go to surgery.
He's giving our cameras complete access as he goes under the knife. But will it work?
It's going to change your life, I'm telling you.
Heading your way, can surgery help our man Colby kick his snoring habit?
So the recovery's not bad at all?
No.
I'm trusting you, Doc.
A couple of months ago, our buddy Colby revealed a very personal secret.
I don't like to tell a lot of people. I don't like a lot of people to know about it. But the reality is, I got a problem. I snore. Bad. It's gotten so bad, no one wants to be in the room with me. The reality is, I wake up every night, a couple times during the night, because I'm not sleeping well. Now, whether it's my snoring or I don't know, do I have sleep apnea? There's something that's preventing me from getting a good night's sleep.
So desperate to snore no more, Colby signed up for an overnight study in a sleep lab.
And here we're seeing quite a bit of snoring. You actually didn't get into deep sleep, or what we call stage 3 sleep, which is the most refreshing, wake up and feel great sleep, which is not that dissimilar to somebody I might see who was 65, 70 years old. You also woke up north of 20 times. I'm not as concerned about that. Bottom line, we were here to answer a couple of questions. One was, do you have sleep apnea? You had absolutely no apneic events. Your oxygen levels stayed quite high. Your breathing looked great across the night, but you do snore quite a bit.
So Colby's doctor is with us in the front row. His name is Dr. Raj Kanodia. He's a Beverly Hills plastic surgeon. So at the lab, it was determined that, in fact, Colby had a deviated septum and he needed surgery. You know, you hear about stars, especially starlets, you know, getting nose surgery all the time, and they say it's for a deviated septum, and then, you know, they come out with this perky cute little thing. What is a deviated septum? How do you get it? And do you always have a deviated septum involved when you give somebody nose surgery?
Septum is a wall inside the nose, and it's protected by the 2 outside walls. So it's supposed to go down straight and divide the nose into the right side and the left side. And either due to a trauma, which you sustain as a child, usually most noses are broken or the septums are twisted when you are like a toddler learning to crawl, fall on your face, bones are not strong enough to protect the inside wall.
But it doesn't bleed strong enough for somebody to go and think to, you know, set your nose.
Correct. I would say 80% of the patients have deviated septum, whether it's mild, moderate, or severe. So all these years I've looked at the septum, and a lot of people don't even know. They say, oh, it's a sinus condition, I have this sinus condition. And they don't even realize that they can't breathe because that's what they've been, you know, used to right from the beginning, right from the childhood. So those are the causes which create deviated septum. And they can create just the deviated septum inside. And you can see, like in Colby's case, you can see in the bottom, the septum is not behind this little wall. It's twisted, it's in the right nostril. So that's the beginning of the septum.
Well, now we want to show you what happened when Colby met up with a good doctor, and if he was deviated, did he get back on track? Let's watch this.
I've tried all the snoring products. I've even been to a sleep lab. Now it's time to take the next step in my quest to cure my snoring: surgery.
I'm putting this camera, it's an endoscopic camera, I'm putting this inside the nose to show the deviation of the septum. She can point it out to you if you're looking. And right here, you see the twist. It starts here, starts all the way here, and then goes, there's the twist right there, you see? And that should be the passage.
Wow. As far as noses and deviated septums go, is mine a pretty severe case?
In the septum, what complicates your septum is because right in the front, it's dislocated off its track. you know, so that makes it more difficult to repair, to bring it back on the track. So we are not doing a nose job. We are strictly doing your work, your nose surgery for functional reasons to make you breathe better. And the great thing is that we will be doing everything from inside. There are no outside cuts, no bruising, because we're not breaking any bones and stuff. So your recovery should be really easy. You know, 2 days of discomfort because you have a sponge there. And I'm going to come in 48 hours. You're going to come back and I'll take the sponges out. So there is discomfort, but once the sponges come out, you know, it's going to be much, much easier.
Wow. So the recovery's not bad at all?
No.
Okay.
All right?
I'm trusting you, Doc. Let's go. It's a big day. I'm excited. We're here. I had a pretty good idea that I had a deviated septum. Now to know that in addition to that, my valves are closed. I mean, I've got a lot of blockage going on. So it was a pretty easy decision to say, all right, let's go to surgery.
The tremendous advantage to the patient when you do it from inside, there's no outside cut, no scar tissue on the outside, and the healing is much faster. The valve area, it was completely collapsed. The cartilages had sunken in and also encroaching into the nasal airway, complicating his breathing. I'm done. Looks amazing, looks absolutely straight. I can look all the way to the back of his throat. And if we compare this from here, this is the before, and the whole front end of the septum is lying in the right nostril. To what we see here is the septum is straight.
Colby, take some nice deep breaths. You're all done. Surgery's over with.
Wow. Find out what happened when Colby wakes up after this. In a few, the 3 tips that could solve your snoring problem without surgery. So our buddy Colby was brave enough to let our cameras follow him as he underwent surgery to fix his deviated septum and hopefully to end his snoring problem forever.
Colby, take some nice deep breaths. You're all done. Surgery's over with.
Colby.
Hi, Doc.
Wow, you're wide awake.
Yeah.
How do you feel?
Well, I feel great. Tell me how it went. Tell me what happened.
Amazing. Better than what I thought I could do. So I'm really happy.
so much.
It's going to change. It's going to change your life, I'm telling you. When I pull this out Sunday morning for you, 48 hours of discomfort for you. When we pull that out, you'll be, and there's absolutely no black and blue, no nothing.
Yeah, no, I feel great.
Yeah, good. Colby,
Doctor.
how do you feel?
Good morning.
Huh?
Good, yeah. Just congested.
Pressure?
A little bit of pressure, yeah.
It's all going to be in 30 seconds, it's all going to be gone. Wow, you're great. Hold the breath, hold the breath, hold the breath. All right, Colby, take your first breath.
Oh my God.
Have you ever feel the right side? Right side, you were so blocked.
Wow. It just feels completely open.
Huh?
That's amazing. It's only been 48 hours since my surgery, and it feels a million times better. I'm gonna get my first great night of sleep.
So please welcome him, our good friend Colby. Colby, come on out. Yeah, have a seat. I have to say again how brave this is of you. I can't believe you let cameras literally go up your nose, Colby,
Rachel,
into the doctor and overnight sleepovers.
Rachel, please tell me we can get the cameras out of my house, out of the bedroom.
Yes, you have paid your dues for sure.
Thank you.
But
Thank you.
most importantly, how are you feeling?
Can you believe it has barely been a week since my surgery?
It's unbelievable.
1
There's
week,
no swelling, there's
no
nothing.
bruising, no swelling, and there
Wow.
I can't quantify how much better I can breathe.
So, did you even realize until you could compare the difference just how much your breathing had been restricted?
No.
I mean, aside from the snoring?
Well, and now going back to all that we learned at the sleep lab, the fact that I wasn't able to get into deep sleep, I can't tell you just the quality of sleep that I'm getting, the amount of sleep, because before I would sleep 6 hours a night, even without an alarm clock, waking up, because I was never getting into that deep sleep. Now, I need an alarm just to keep me from going over 8 hours, because I can breathe better.
Is that the greatest thing that you've learned through this whole process?
It's a rebirth, it really is.
Wow.
Yeah.
So, you know what's funny is in this whole time you've been chatting, you haven't even brought up the snoring once. It's like, it's changed the quality of your life so much. It's sort of a byproduct. Who cares if the snoring gets better?
For me, it is, because I don't know if I'm snoring or not. I do know I'm getting a lot better sleep and a lot more of it, but the snoring stuff I still don't know. And one thing I got to say, Rach, that I was most surprised about, when Dr. Kanodia went in, he was able to take all of the cartilage and some of the bone that he removed and use some of those pieces to go in and reconstruct the inside, to open up the passageways.
Wow.
So there was no artificial splints or braces or anything in my nose other than natural cartilage that he sewed in.
He just went in and maneuvered it back into.
Oh, he cut it all out. He cut it all completely out, laid it on the table, and was able to go back in and use that to restructure. Dr. Kanodia can explain better. But it's how he opened up all my passageways. It's unbelievable.
Took the whole undercarriage of the car out and then rebuilt the motor.
Oh, yeah. I've got a hot rod nose now.
Well, Colby did it again. He let us sleep over. So here's Colby on his latest night's sleep, and let's see how he's doing. Look, you're not waking the dog up.
The first time I've seen this. And Deuce is not getting out of the bed and leaving. I can't.
He sounds great. Now, there's some tips for everyone to reduce their snoring if they're not going to go, as far as surgery.
Well, the snoring is, if it's assumed that it's due to deviated septum and you cannot fix the deviated septum, then you should reduce the swelling inside the nose, and that's caused by air conditioning. If you run the air conditioning or heater whole night, that causes more swelling, and that impedes the airway, so that'll create snoring. Humidifier is a great idea. Having a humidifier in the bedroom, allows the air to be moist, and so you don't have the irritation. And the third thing is what we saw on the television: no pets in the bed, because
I couldn't sleep without my dog, right?
For you and I.
It would be horrible for us.
Yeah.
So I'm glad you had the surgery. I know you. You couldn't sleep with your dog.
I can't kick Deuce out. I just can't do it. But I did take the good doctor's advice. I got a humidifier. And the first couple nights I didn't have one, and I told Dr. Kanodia I was really stuffed up. My head was still draining.
Right.
And I haven't, since I was a child, slept with a humidifier in the room. It made a huge difference. I mean, it was nice,
I always had one when I was a little kid,
When I was a kid,
and
I
you
did.
forget how much rest and peace it can give.
And they're super reasonable. Went down to the drugstore, bought one, and I've used it every night since he told me. That's great.
That is a really good tip, honestly. I had croup a lot as a kid, terrible breathing. And the humidifier really does help a lot. Thank you so much, doctor. Guys, if you want to chat with Colby about this or any of his other experiences, you can always check him out on our website, of course.